You're listening to the Black Excellence Podcast, untold stories of passion, persistence, and perseverance. Brought to you by BlackHealthWealth.com. And now, here's your host, Brian Lee.
Yeah, so today I got Dr. Charles on the podcast. My boy, man, we go way back. And, you know, this man has been doing some things, and he's been paving the way, making his own route, man. I haven't seen anybody take this type of route that he's taken. But I guess why don't you walk the people through like your experience, I guess your educational experience, and then also like some of the stuff that you've been doing and working on professionally.
I recently sat down with Dr. Shamard Charles, a social epidemiologist, to ask him about strategies to try and get the rest we need and how to figure out the right amount for you.
I think everyone has to do a risk reward. If you're a working mother of two, Shaq, you're one of the biggest stars in the world. You're a 4-time champion. Dr. Ofili, you're one of the top cardiologists in the world. What brings this partnership together?
Well, I met Dr. Ofili a couple months ago, and she...
This is the Black Excellence Podcast. Get ready for Black Excellence.
Thank you, Brian, for the wonderful introduction. I really appreciate it. For all of y'all who don't know, my name is Dr. Shamard Charles. I'm the former senior health journalist for NBC News. I'm currently a senior writer for Very Well Health. That's under the Dash umbrella. I'm the host of a podcast called Heart Over Hype on the Belief Podcast Network, and I do a host of other things. I'm also a teacher and educator and instructor and everything under the sun. So I'll take y'all just through a little bit of my journey, how I got here, how I transitioned from being a doctor to a journalist, and never really taken off both hats completely. So my journey kind of starts in medical school, actually. I was just, I never thought I would ever be there. I'm just a kid like anybody else, humble upbringings, wonderful parents, first generation Haitian. Shout out to New York City, shout out to Brooklyn, shout out to LI. Just a regular guy. But I was fortunate enough to always have parents, family, friends, always sort of push me along. I always felt like I was kind of like the rose that grew from concrete. Fortunately enough, I was able to go to NYU with my boy Brian here, transition that into a post-bac at City College. From City College, I went to Brown for medical school, and then I flipped Brown, took on a contract position with NBC as a senior health journalist, and then transitioned from doing journalism at NBC to getting a master's in public health at the Chance School at Harvard. So all of that is to say that you can go through a lot of different transitions in your life, but the most important thing is for you to have some type of end goal at the very end. So for me, my end goal was to increase health literacy. So it wasn't necessarily just to be a doctor or just to be a journalist or just to be a writer, but it was in some ways to connect to people on a very intimate level so that I can increase their health literacy. We don't all have doctor friends that we can check with to get medical advice or to get health and wellness tips, but we have each other. And so my journey from when I was a medical student all the way to now has really been just a labor of love and trying to put myself in spaces where I could increase health literacy, especially for Black and Brown people.
Dope, man. And then so from med school, you went into NBC. Like how did the opportunity even present itself? Like how did that come about?
Man, it's crazy. I am definitely an example of if God has something for you, it's for you. It's already written and it's set in stone. You just got to really work hard, be prepared, and stay in motion. So I was fortunate enough to actually see the light even through some tragedy. So I'll explain that for you a little bit. When I was in medical school, I thought, man, I'm going to be an internal medicine doctor, or maybe a family physician, or maybe go into another specialty called physical medicine and rehab. So actually, I was like taking my board exams and applying for all of these different residency positions. But while I was on that path, I decided that I needed to get some broader experience. So I told myself, I'm going to do two things. I'm going to write my butt off so I can get, published and have some broader research and technical writing experiences under my belt to make myself a better candidate. But I also decided that I wanted to do to marry all of these different interests and to do it globally. So I decided that I was going to go into a global health route. So along that journey, I actually applied for a small fellowship that allowed me to go to Santiago, Dominican Republic. So while I'm applying for the fellowship, I'm like, all right, well, I'm gonna apply for the fellowship, and I'm gonna do 2 or 3 different things to make myself the best candidate for all of these different opportunities that were presented to me. During that process of writing, I had a bunch of my friends who would serve as my editors. Nothing fancy. They just believed in me. They loved to see me write. I would write on social media a little bit, kind of on a quarterly basis. It seemed like there would be some traction. People would comment, like, share, hit me up on the side and tell me that they were inspired by some of the health and wellness stories that I was sharing on social. So I had a belief, I had a sense that there could be something here, that maybe I was a talented writer. And so I wanted to use that to the best of my ability to maximize some other opportunities. While I was on that journey and my friends were editing my work, they actually really encouraged me. They were like, hey, Sham, you should probably maybe get a writing mentor, maybe think about something in media. You have a powerful voice and a real talent for writing. You might want to think of that. But at the time, my mind was not set on that. My mind was set on, I'm about to go do clinical medicine, and that's all I'm going to do. So I was actually fortunate enough to accomplish at least the first step of my goals, which is I got published. I went off to Santiago, Dominican Republic, and I was doing some global medicine work in the infectious disease world. So while I'm in Dominican Republic, I'm working at a children's clinic. And after clinic, I decide that I'm just going to play a pickup game of basketball with some of the kids there. Maybe within the first few minutes, maybe like within just the first 5 minutes, I literally just took a misstep and I ruptured my Achilles. So when I ruptured my Achilles, I knew immediately that it was ruptured. Heard a snap and a pop, and just was like, felt a snap, heard a pop. And I just knew immediately that I had ruptured my Achilles. I had learned about this in school. I just kind of knew. So I had to be rushed back actually to the United States to get surgery. But during that time, they actually allowed me to stay in the Dominican Republic for a few days just to wrap some things up. So as I'm wrapping some things up in the Dominican Republic, I start to think about my life a little bit more intently. And that's one of my first major points is intention. So I started thinking about my life and my path more intently, thinking about how I'm going to finish out the school year, thinking about what life is going to be like not being able to walk for 6 months, thinking about just the day-to-day of, brush my teeth, taking a shower, and activities of daily living, how I'm going to accomplish those. And essentially, I started to write from a place of pain and a little bit of a place of fear, because everything had been set up for me to that point. I had worked so hard to accomplish a number of goals, and I felt like in 1 second that was being cast aside. So I started writing, and I started going back to those same sources that always encouraged me in my writing career. And shout out to Calvin, shout out to my boy Sankit. I definitely talked to those two brothers a lot during this time. Shout out to my brother Jory. I spoke to my tribe, to my village, and asked them what I should do. And they said, you should do what you always do. You should lean on the things that work for you best, which is your natural talent and gift to write. In many ways, writing was it was a respite for me. It was a way for me to sort of get away and disconnect from a lot of the turmoil that was happening around me in the world. But it was also a way for me to connect more deeply with myself. And so they said you should use your writing as a form of therapy, but you should also use your writing as a guide, right? As a guide to doing the next thing, to looking at the next thing, as opposed to looking at this injury as an end. Look at it as a beginning, as a door opener for the next chapter. And so that's exactly what I did. I went on a mad pursuit to look for writing mentors and people who were published authors and people who are bloggers, people who had a lot of credibility in social media, really anyone who had a platform that they could connect with other people. I just essentially asked people within my network. To make a long story short, through a series of different connections, one being through an opportunity to be a fellow at New York One. I actually didn't take that opportunity to be a fellow, but I actually kept in contact with many of the people that ran this fellowship for medical journalism. And through keeping that contact, even within an opportunity that I didn't particularly take part in, just by keeping that contact, I was able to parlay that contact into a series of conversations that essentially led me to my boss, Susan Wagner at NBC. She actually was my writing mentor. And then from that, she said, you have a gift. You may have a gift to be a clinician. She wasn't sure because she had not been on the medical side, but she had started up a medical unit at ABC and was transitioning to NBC. And she said, you have a gift to write. And whenever you are ready to transition from a clinical career to a career that was in lay media, she would be more than happy to take me on. And I essentially went there as just a contract writer for NBC and worked my way up the ranks into a more senior position.
That's dope, man. And so obviously, like you said, you're Haitian. So tell me what that was like with you walking your parents through that. So you about to be a doctor and you decide to go into writing. Well, what was that like? Or how did they, what were their thoughts on that?
Man, you know what? I actually think that the first conversation that you have with your parents, especially when you're first gen and you're a Haitian guy, is you actually tell your parents, like, before y'all just jump off the ledge and before y'all go nuts, I just want to explain to you that I'm always going to be a doctor. That's the thing, right? It's like, I'm not transitioning from being a doctor just to a journalist. Like,
right.
This will always be me. This will always be a part of my identity. Because I oftentimes think that your career path, especially as a male, at a first generation male, oftentimes your career is somehow tied to your identity when there are a ton of other things that should be tied to your identity that I think are sometimes overlooked, right? I think how you treat people is so much more important, right, than your career. But sometimes I think that those things are a little bit overlooked because the career focus is the thing that is our main identifier. So I think for me, when I was starting that conversation, I had to let them know, like, remember the son that you raised, right? That's like the most important thing. And it's not necessarily the career path that I'm taking or the change or shift that I'm taking in my career path. Just let's always keep the focus on the fact that, my mission to help people and to increase health literacy, that hasn't changed. But the path that I'm taking to get there has. And so once I broke it down for my parents, I think they were cool with it, just because they've always trusted me in terms of my decision making and making the right decision, not just for me, but for us as a community. And so they were cool with it, but I will say it took a little while for them to be comfortable with it. So they were cool with the decision, but it took a while for them to get comfortable with it. But I do remember my neighbor Barry and my dad. I remember the first time that they saw me on the news, like on NBC News, and I remember they were just flipping out, and they were just so happy and so proud of me. And they always encouraged me back then, and continue to encourage me now, to be the best at whatever I do. So because I was taking a path where they could see visibly that I was doing my very best and that I was succeeding, I think that you know, that made them so happy. So yeah, they were cool with it. You know what I mean? But it was definitely unconventional, and it took them a while to get comfortable with it. That's for sure.
Yeah, no, that's good. I mean, it's even with me and my mom, it's a lot of things that she just doesn't understand, just because you know it's a different generation. So it's almost it's after it's done. It's the result, the product that they see, and then like, oh, you know, obviously they're proud of you as their child, but in certain cases when it's making that decision to do something, you know, it can be difficult to get, you know, people to understand it. I mean, it's not everyone, but I know for me, it's the same thing. You
Right.
know,
I think honestly, I think with parents, you know, they look for stability in many ways, and that's okay, right? They
Mhm.
see that stability means that financially, socially, emotionally, mentally, that we are secure, and I can't fault them for seeing a measure of security in stability, and that being in, intertwined with their measure of love for us. I definitely can't blame them for that, but I think that maybe a little bit of a difference between our generation and maybe their generation is that we have another bank, and that's the social capital bank. And if we make enough connections and we put more money, right, social currency into our social capital bank, it actually allows us to take a traditional route and another route, right? So we don't have to do that one thing, right? You don't have to do that one thing where we're just going down a road and we're like, I have to make it. They paved the way for us, right? By sometimes doing that, right? By sometimes sacrificing 2 and 3 other routes, 2 or 3 other paths. Maybe they sacrificed going down those paths for us to allow us to do that, you know? So I think if security and stability is intertwined in how they show us that they love and they care for us, I think it's a byproduct of the path that they've taken. And quite frankly, we are lucky and fortunate and incredibly blessed that we can take multiple paths or that we can deviate from our set current path. So, you know, I get that love, brother, but our love and how we show it to ourselves and to our kids is going to be very different. It's going to be very different because I think the social context is wildly different.
Exactly. And also that I think that access to information and really starting to understand what's possible out there. Yeah, I mean, because for me, like most people, you know, your parents are like, oh, go, you know, get a job, work for someone, and you'll be successful that way. But it took me a long time to figure out that maybe just that alone is not fulfilling. And also it is very limiting to the potential that I have or that others have. And, you know, so it's really been over the last few years where, you know, I've been just willing to even open up to new things within my jobs, and even just putting myself out there beyond just my job, just within the industry, within the advertising industry, and then now within, you know, broader industries. And doing so, yeah, like you said, it opens up opportunities that you don't even know about.
Right.
And so, yeah, I mean, it's definitely good to think outside the box. And even with you, like, while you were in school, like, you were doing some writing too. So, like, talk about, for those folks who are either trying to get into writing or to make money, like, about the opportunities. Because I know, you know, you did some writing and editing for international students and you know, different things outside the box to bring in income.
Right. Yeah. Honestly, I think that there's a lot of talents and a lot of gifts that we know that we might possess, but we don't necessarily harness it as early as some others. That's totally okay. I never thought that writing and editing, like essays, for example, for international students, even as an undergrad, I never took that as like necessarily a gift, you know? I didn't see it as a gift, and I certainly didn't see it as something that I could widely monetize. I looked at it like, this is a skill that I have to put some, you know, pocket change, in my pocket. I didn't necessarily look at that as a gift, right? So I think one of the important things that you learn when you're young is how to translate skills into actual gifts. And once it becomes a gift, then you can monetize that, right? Because then you have something that no one else has, right? You have a lot of people with skills. You don't necessarily have people who are passionate enough to translate that into a gift and to monetize that gift. So as an undergrad, I was correcting essays, tutoring students, writing for myself in terms of publications. I don't know. You probably remember not the Wall Street Journal, Washington Square News.
Oh, you wrote for that?
Yeah, right.
Oh, I didn't even know.
Yeah, right. So there's just small things that you do, and you're just bringing in $50 here, $100 here, and you're not thinking that, wow, like this is going to be a part of my career moving forward. But I think that as you're writing, seeking out constructive criticism, seeking out feedback, not just when you're writing, anything that you're doing in your career is important. I was fortunate enough that even when I wasn't seeking out that constructive criticism and that feedback, I was getting it anyway, right? People saw something in me and were like, you know what? If you want to do this a little bit more seriously, these are the things that you have to do. People sent me off to, different places so I could network, so I could get mentors. And then the mentors became sponsors. And then the sponsors, who were then my bosses in many ways, then they put me in rooms where I could network to another degree. And it was just really a cycle. And it really helped me to hone my craft, because as I was put into all of these different environments, I knew that I needed to step my game up. Also, I think that school is very powerful. As you know, I've done a lot of school, right? Like I went to NYU and got my bachelor's in psychology and general education. I did a post-bac in biochem. But I wasn't that kid who was just like a one-track kid. Yeah, I was getting my post-bac in biochem, and I was still taking English classes and creative writing classes. Because during that time, I knew that I wasn't just going to school to harness one skill. I was going to school to harness as many skills as I possibly could. And I wanted to figure out which one of those would stick and how I could monetize that. So yeah, starting young and just figuring out what skills you have and seeing how you can be passionate, or which one of those skills you're passionate enough to develop that into your true gift. That is like so important. And you can monetize that early, and then you can flip that and you can monetize it to a greater capacity once the stakeholders and the amount of financial backing with the environments that you're talking to later on, as those grow, you can learn how to monetize that on a bigger level. You can scale it, so to say.
Definitely. And I'm glad you mentioned networking and mentorship. I was going to ask you about that next, just in terms of how did you navigate NBC once you got there? Because I mean, you moved up and was making moves really, really quickly. It sounds like you came on as a contract writer, and then, and I'll let you talk about just like all the various things you did within NBC, but also talk about like how you were able to do that and to navigate corporate America as a Black male.
I'll say that probably the most important thing that happened is that when I was signed, I was actually, even though I was a contract writer, I was signed to a team. I was signed as part of the NBC News medical unit. So we were a team of 8 people. So I actually, within the team structure, I had an opportunity to learn from 7 other individuals. I think that there's no better learning than learning on the job. So I was super fortunate in that regard. Also, I looked at other primarily African-American employees that I wanted to model my writing and my journalism after. Some people that come to mind were Morgan Radford, Craig Melvin, and several others that I looked to be honest with you, and they weren't just all African-American. I also had Carson Daly and several others, that Lester Holt, that I looked to, and I was like, oh, I want to model my journalism after them. So that they had a really high bar. So I was able to write and to at least try to approach that bar even early on in my career. I knew that I was never going to be a writer like Lester Holt or Craig Melvin, at least in the very beginning. But I knew that if I, at least stylistically, if I used some some tips from them and I incorporated it into my own style, I knew that I could develop a very unique style that was marketable. So I definitely looked to people of color within the company for guidance. And then I would say that the last thing that I did is I used all of my networks and avenues to help legitimize my work. So like, what do I mean by that? As a writer, you get heavily scrutinized by people you don't know, right? That is like one of the hardest things to do. You're writing something because you care, you're passionate about the topic and you care about the people who are reading it, but people don't always necessarily agree. So I was heavily scrutinized for many things in terms of writing style, in terms of content. I was heavily scrutinized. So I learned very early on in my career that I needed to write at a level that people could understand without losing too many layers of complexity within that. Health is a complex topic to talk about. So I needed to make sure that the writing was rock solid, the content was rock solid. So I actually had to do maybe a little bit more work than the average person, especially being a young physician. I was 29 years old when I signed with NBC. So I had to make sure that all of my sourcing, all of my stories, my fact checking, I had to make sure that everything was rock solid. And I took a lot of pride in that. I took great pride in that. I think that the quality of my work spoke for itself. NBC has a tremendously large network and reach. So I was able to monetize that by being a leading voice in issues that, quite frankly, were really difficult to explain. But I found a way using critiques from fans, a ton of help from my team, and a lot of personal support from my family and friends. I was able to take on that trifecta in such a way that it legitimized my work, it helped my work, it critiqued my work, it refined my work, so that I was able to produce really, really strong work. And then it kind of took off like fire. Once I went to broadcast and people put a face to the words, it just kind of took off.
Dope. So, I mean, take me through your writing process. Like, how do you turn out content consistently and still maintain quality while not burning out?
Man, well, for one, you got to keep your ear to the beat of the street. You know what I'm saying? You have to be in and of the community. You know, I see a lot of writers, they're perched up on a hill. I don't know how they do it. I think so much of the energy, so much of the ideas, it comes from the community. You need to hear what people are thinking about. People talk about health all the time, but they're not necessarily gonna go and seek out health content. It's kind of things that, like, we talk about with our friends. You see a lot of memes about it, but are people doing a deep dive on health and wellness? Probably not. So I think for me, it was important for me to kind of listen to all of the side conversations that people were having about health and to lightly expound on those topics. So I think that's the one thing, is staying connected to the community. That's probably the most important thing that you can do as a writer. The second thing is to keep writing. Oftentimes when we have writer's block, we stop writing. We say, oh, I got to take a break. I would reckon to say that doing the opposite is more helpful, right? Writing is like a skill. It's like working out. You got to exercise that muscle. So you should never stop writing, and you should never stop writing original content. That is super important, that the content is original, because that creativity and the love that you put behind it, it builds confidence, and really it just helps you to figure out things about yourself as a writer and take you to places that you just never imagined that you could go. So keep writing even when you have writer's block. And the last thing that I would say as a writer is to always keep yourself informed, to be a forever learner. You gotta love learning. It takes researching, it takes talking to different sources, especially primary sources, and sifting out stories. But it's really important that you love learning and you love different takes and different angles on the things that you already know, and quite frankly, new angles on the things that you don't. So you gotta love learning.
Dope. And then, so what was it like transitioning from writing to actually being on camera? And then how did that come about? I mean, is that normal, or how did that happen?
Man, it was different. It was definitely different. I think talking to a camera it has so many small nuances that I think I, as a writer, took for granted. I'd never realized how difficult it is to do that job. But that transition came from just a producer. Her name is actually Casey at NBC News now. She's identified me as someone who thought I might be decent on TV. My boss, Susan, when she hired me, she had actually told me, like, you might have a career doing this. You're just not at the place now. You're so young and unrefined that right now, putting you into the broadcast waters, it would just be putting you at the deep end. And I don't know if you'd be able to make it out, but by starting as a writer and doing the thing that you're very good at, we can build up your confidence and we can slowly transition you to broadcast. But after 2 years of writing, I didn't see a career in broadcast at all. In fact, I didn't even see a career where my voice would be heard on any type of medium outside of words on a piece of paper, right? So I didn't even see that for me. So nothing about a podcast, nothing when it came to broadcast TV or news television, nothing of that sort. So I was content in a way to just stay within the digital stream. But Casey pushed me, and she said, after several conversations, she said, you can do this job, you know? I'm a producer. I've seen a lot of on-air talent, and you're no different than them. It all takes a lot of hard work. You know, you have the educational experience, a proven background. You've had 5 years of experience in public health. You can do this work. And so that confidence and that push helped me to slowly transition to broadcast. I was fortunate enough to do broadcast work on a streaming network, so I didn't have the pressure of being on national TV or local TV. So I was able to slowly transition myself to broadcast. And once you get into broadcast and people start seeing that you can actually do the work, then I think other producers are more comfortable approaching you to cover their stories.
Definitely. And then not only that, I mean, it seems like they even carved out something for you and even started, you know, experimenting with new ideas for you. So like NBC Black, that was something relatively new, right?
Yeah. So NBC BLK, man, shout out to them. They are just like amazing. They're doing amazing work out there. They have a series of stories that obviously empower people of color, especially Black identifying people of color in the month of February for Black History Month. So during that month, I actually started, I think this was, I want to say February 2018, I really started working with them and carving out health stories within the Black community. And that reignited a passion in me to talk about health disparities and health inequities, social determinants of health. And that really almost became a niche for me, right? So from working with them, the health and medical unit, which I was a part of, they said, this comes really natural to you. Just talking to people within your community is natural. I think for you and I, we're like, duh, you know, we know that. Right? Like that wasn't, you know, right. Like, you know, that's not rocket science, right? That it's easy for people like you and I to talk to our community, and that by talking to our communities and producing amazing stories, that those ratings would be super high, right? Like for us, that is like not rocket science at all. That was not surprising. But for them, I think that it was not in that, oh, you just connect with people who look like you, but to the breadth at which me covering a story versus someone who's a not Black identifying person of color covering the same story, that was surprising. That delta, that difference in what it looks like if I do it versus someone else. And that's where carving out the niche specifically for you comes in. It's putting yourself in spaces that we're all like everyone is in, and then jumping out of that space and not being afraid to cover the things that are Black based, to be honest. You know, sometimes I think that we see ourselves as being a little bit of a pariah if we separate ourselves from the greater white establishment. We think like, man, if I just do this for Black people, then they're gonna cast me off as just the Black guy, just the Black woman who can only do Black shit. I can only cover this one topic. But I think that we do that in some sense, right? That because that does exist, but in some sense we do that to ourselves, right? And we don't want to box ourselves in by doing one or the other, right? So I think that it was important for me to do the stories that touched all Americans, but then to do the stories about Black America and show people how that too should touch all Americans.
Definitely. And like you said, you keep your pulse on the state of Black health. So I guess with COVID-19 like heavily affecting Black communities, what are some things that you feel like people can do to just like try to improve their health and to just to stay healthy?
Yeah, I think during a time like this, you know, the gyms are closed, right? So we want to tell everybody, hey, I want you to be as healthy as possible. And I want you to do it in 3 ways. I want you to get your diet right, exercise and fitness, and then mentally, emotionally, and spiritually, right? Those are probably the 3 parameters that we look at when we talk about health and wellness, especially in the Black community. But I will say, and I'm going to start with the physical health, that it's very difficult right now for people without a gym to hold themselves accountable, right, to the exercise part of things. But I will also say that that is not an excuse, right? We can all walk, right? We can all run. We can do yoga in the household. For those of us who have more means, we can get an exercise bike or maybe a Peloton, right? I understand that those things are expensive, but I think to the extent that we can exercise, we should exercise. As you probably know, diabetes, especially type 2 diabetes and obesity, are on the rise in the Black community. And twice as many African Americans have died in the pandemic as any other group. So, you know, given the statistics and given the rising rates of type 2 diabetes and obesity, it is incumbent on us, an imperative that we exercise. If you didn't exercise before, it's a great habit to start now. And if I could suggest one thing, I would say start with a daily walk. 40 minutes, moderate intensity. So that means you're getting your heart rate up a little bit and you're sweating a little bit. I think that's a great start. And the second thing that I would say is including more of a plant-based diet in your diet. I'm not telling the meat eaters to go plant-based per se, but what I will say is there are anti-inflammatory and nutrient-dense foods that we can all incorporate. And to be honest, it's actually not more expensive. One of the arguments that I get is, Dr. Charles, it's more expensive for me to eat healthy than for me to eat unhealthy. And I would counter that by saying it's not, right? If you go to the perimeter of your local grocery store, you will find that there are a ton of sales on produce, and it's really, really, really easy to make. I understand that not everyone has access to a kitchen and so on and so forth, so we can have a broader discussion about ways that we can eat healthy without access to some of those in-home resources. But for those of us who do have access to a kitchen, I would encourage you to go to your grocery store, to shop on the perimeter of that grocery store, and to get nutrient-dense and anti-inflammatory food. So I'm gonna give you a couple of those. That's avocados, that's turmeric, that's celery, that's Brussels sprouts, corn. Corn is super high in fiber. berries, especially raspberries and blackberries, cherries. These are all things that we should be incorporating into our diet. And I could just, the list goes on and on and on. Quinoa, kale, butternut squash, things of that sort. So these are all things that I think we as African Americans, we have these things in our diet. If I tell an African American person, and I talk to many, if I tell them, hey, incorporate more garlic or more ginger or turmeric or kale or celery, like in your diet, people are able to do that seamlessly if you give them a path, right? So if your meal of choice is gumbo, you can incorporate all or most of those things in that, right? And so you have to meet people where they are, and you have to give them a direct path to being healthy. It's not enough for me to just suggest certain foods to eat, but it's important for me to incorporate that food within a diet and a structure that works for you. And, you know, when you talk about COVID, man, I could go on and on about the disproportionate impact that it has had on the African-American community. But again, I will stress that what we're seeing on social media and different outlets as alternative medicine in our community, brother, it's not alternative, it's original medicine. And that original medicine is to incorporate, again, nutrient-dense foods, anti-inflammatory foods into our diet consistently and every day. We get it a little bit more in plants, but again, I'm not saying the meat eaters that they should completely put that away, but a shift in incorporating more of those plant-based foods is very helpful in fortifying our immune system. In fact, on my podcast, I'll actually be having a segment called immunoboosting, and really emphasizing the need to have more nutrient-rich foods in our diet.
Definitely, man. It's a few things there I want to touch on, and it aligns with us with Black Health and Wealth. The health impacts everything, man. And a lot of it starts with the diet. And so for me, I am plant-based now. I'm vegan solely. And part of it is just, you know, I was the biggest meat eater out there, but when looking up stuff online and, you know, following advice and stuff not really working. But then when I did this, you know, one plant-based diet and fast and cleanse, I saw results, not just with losing weight, but the way I felt was just crazy. And so that translated into other areas, because in terms of mentally, the clarity I had was just crazy. And then, you know, I wasn't as stressed anymore. I wasn't getting as many like headaches from work and being stressed out anymore. And a lot of that is sugar, but a lot of that is some of the other things that we eat. And so I went plant-based. And not only that, since I've done that, when we talk about the wealth side of Black Health and Wealth, or just business side, like everything else has skyrocketed for me. So I've had that clarity of thought.
I believe it.
Yeah, I've had that clarity of thought. You just feel so much better doing that. So yeah, I agree with all that. And then, and I agree with helping people to understand how to make it right. So like when I started, it was difficult. It's like, all right, well, yeah, I know you need to eat fruits and vegetables and all of that, but what I'm going to eat, man? Like, what does that mean in terms of making a meal?
Yeah.
And, you know, when I went plant-based, I started off even, you know, more restrictive. I started off with the alkaline diet and the Dr. Sebi diet.
Uh-huh.
So then there was even less resources for that. And so, you know, me and family, we figured it out on our own. But as we were doing that, and I started posting content on Black Health and Wealth, you know, for a while we were like dominating the rankings on Dr. Sebi, and we had like the food list there. We had like just information about it, but people, just like to your point, will still ask, okay, well, how do I do this? So it was like, all right, cool. Then that's when it came out with a cookbook. or recipe book, just to make it even easier.
Right.
So that, okay, you know what ingredients you need to be using, but you don't know what to do with them. Okay, here's a cookbook. Here's an example of a 7-day or 10-day plan that you can use, so you don't even have to think about it. So we did that. And then even with that, you know, people would ask questions. So then it's like, all right, let's start creating products. We started to create products for people. And even like the vegan pancakes that people were going crazy over, or curry mix. So trying to make it something that what you're used to, but using real ingredients instead of man-made stuff, or instead of meat or dairy. And so that's, you know, to your point, that can make it easier. Like, how, if you like something, okay, how can you make the plant-based version of that? Because you can. The difficulty is just that we haven't mastered that, at least, you know, over the last however many decades, or maybe even the last century. We haven't had our best cooks, our chefs, our family master how to cook plant-based as good as they've mastered how to be a meat eater and dairy. Once people do that, then, you know, we're going to have all the stuff that we like, and it's going to taste the same. It's going to taste good. It's just we're going to need, like, you know, some of our best people in the kitchen to actually go ahead and take that challenge and use their creativity to do it. But it's very
Brian, I'm going to cut you off for a second, because I think that's where healthcare professionals need to be a bridge, right? Mm-hmm. And it's not just healthcare professionals, but I'm going to say all medical professionals. So that's your nutritionists, your dietitians, is people will incorporate behavior when the leaders, right, at the top, and the linkers, right, endorse said behavior.
Yeah.
Right. So I think that it's important for us, right, as leaders, to endorse the behavior. I think it's important, right? So next level down, right? So our chefs and our sous chefs and our nutritionists, it's important for them to make the food actually tasty, right? And easily accessible at a price point that people can afford, right? The same way you have a McDonald's, there's no reason why we shouldn't have some type of chain plant-based restaurant that people can get a full meal for $5 at the same price point, or $6 or $7 that they would get, you know, I don't know, like a number one or a Happy Meal or something like that. Like, you know what I'm saying? At a chain restaurant. But it's got to be at least on level, on par to taste, right? So I think that sometimes in the medical community, we try to remove ourselves from the very sort of like real part of it, which is like food has to taste good, right?
Yeah. No, exactly.
We talk about it just on like a nutritional basis. Like, you talk about it, quite frankly, like I was talking about it before, like, oh, this is nutrient dense, but it's like, why is like a nutrient rich food actually good for you? And the only way, right, the only ways that you can encourage people to incorporate that is to have these meals easily accessible at a price point that they can afford. It's got to be tasty, and then we also have to explain that this is a long-term thing. So I'm going to get into something a little bit technical, but just bear with me. So there's system 1 and system 2 thinking. System 1, right, is emotional, right, and it's intuitive, and it's the type of thinking that comes into play when it's fight or flight. If I'm hungry, I'm gonna get the thing that's right next door, healthy or not healthy. If I'm hungry, I'm gonna get the thing that's next door. And if it's cheaper, right? Once I see it, healthy, not healthy. If there's 2 things next door and the thing that's cheaper, that's the one that I'm gonna go for, right? And so we need to capitalize on system 1 thinking, which is, again, our connection to the flight or flight response. We need to leverage that, right? And we need to have a healthy thing next to an unhealthy thing, but at a price point that's lower than the unhealthy thing, to incentivize people to go for the healthier thing. That's one. Number 2, we need to encourage people who want to keep the black dollar within their community. We need to encourage them to go to certain places. So if there is a black farmer, right, who is supplying produce for a specific shop, we need to endorse the Black farmer and promote the Black shop, right? So that we're actually keeping the Black dollar there, right? So now we're not just promoting the healthy behavior, but now people who are still on the fence, maybe you can convince them to do the healthy thing by using the financial argument of keeping the Black dollar within our community. So I just wanted to cut you off there and to highlight those points, because again, I, as a healthcare professional, don't want to remove myself from the very real nitty gritty of the issue, which is finance, right? Like, this stuff has got to be affordable. Access, it has to be there, preferably not next to an unhealthy place, but since the unhealthy places are here to stay, especially those big conglomerates, they need to be there. But also we need to do a better job of endorsing and promoting those foods for people, so that we remove every single barrier and excuse that could be made to not do it.
And exactly. And definitely, I think the same goes for exercising. You mentioned exercising, and we're actually doing some of that at Black Health and Wealth. You know, and that's something for me that I've struggled with since college. In college, I was, almost every day at the gym, playing ball or just staying active. And once I left college, honestly, I just haven't exercised. But I've actually probably exercised the most consistently since college during COVID. And it's been virtual things. And so on Black Health and Wealth, we're actually going to be releasing some virtual classes, and actually, some from folks, So one, we're going to be doing, we have someone who's going to do a yoga course.
Okay.
We're also going to do Caribbean dance classes with Stephanie Dormancy.
Yeah, that's
Dormancy,
awesome.
so she's going to do that.
Great.
And then we're also going to have more of a regular type of digital class as well, probably from Pat.
Okay.
Brizard, PB3 method. Yeah.
Yeah.
So we're going to offer that as well, like to your point, to try to make it accessible and provide it to people is digital. The stuff that you can do is in your living room. It's from people that look like you, good people. They're good people, and that positive energy. And so, to your point, that is important. But when it comes to doctors, a lot of times you'll hear from the Black community, they just feel like, it's been happening with COVID, but even separate of COVID, where a lot of just patients don't feel like they're getting the attention they need from their doctors. So what's the importance of actually having Black doctors? And, how do we get more?
Yeah. Oh man, that is elephant in the room, right? We need more Black doctors. We need more doctors in general, right? I gotta just say that first. So anybody who's listening to this, who is interested, please contact me so we could walk through the steps, because I think that is fundamentally important, that we just have more doctors. It's even more important that we have more Black doctors, because the studies say, especially in the field of cardiology, that Black patients who have Black doctors are more likely to be compliant when it comes to taking their medication. And so that is just one nugget of many nuggets, right? They're also more likely to return for a second visit. They're more likely to follow the instruction of the doctor when it comes to diet change, so on and so forth. And that's not necessarily just specific to Black people. The Latinx community, it's the same. The South Asian community is the same. People who look like you are able to get better outcomes for their patients because the compliance rate shoots up when they're talking to someone like them. And so, and for me, and that's what the studies say. For me, on a personal level, I think that there's a level of stress relief that comes when I'm talking to somebody. The minute I walk into a doctor's office, if I see another Black person there, or I see another person of color, my stress goes way down. There's a phenomenon called white coat hypertension, right? It's like your hypertension spikes up, your blood pressure spikes up when you're at the doctor's office. I gotta tell you, I never experienced that phenomena when I see a person of color there. I have to wonder to myself why that is. So there's, on a personal level, there's just a level of comfort that is there. In terms of increasing, honestly, to go to medical school and to take this academic route, I got to tell you, it's expensive. You're always fighting for scholarships and different things. Many of our parents, because of the racial wealth gap, they can't afford to just pay for all this schooling, right? So I definitely think that it's incumbent on the federal government to provide more money to residency programs and medical schools that are specifically tailored towards increasing the recruitment and retention rate of African-American people. I think that it starts there. And then I think the second thing is, as a society, we laud entertainers and celebrities and athletes, but we don't necessarily laud people who are in the science, technology, education, and math fields, or the engineering fields, STEM. So I think that we have to glorify those fields a little bit more than we do. I'm a public health doctor. I was the only African-American male in my graduating class at Harvard this year. That's an atrocity. I think it's very important for us to publicize these career paths as career paths where people can make a living, and not just a living 5, 6, 7, 10 years down the line after we've paid off loans, but they can actually make an immediate impact on their community while making a reasonable living within, within not just the health, but also the public health field as well.
Nice. So you're launching the Heart Over Hype podcast. Tell me a little bit about that podcast, when you're launching, what you're going to be covering.
Yeah, man, I'm real excited about this. Heart Over Health is a health and wellness podcast. It really takes a holistic approach to health. So that means we're going to talk about physical, mental, emotional, and spiritual health. We're going to have an incredible speaker come on every week that will be interviewed by yours truly. Really, we're talking about health at the intersection of sports, education, politics, culture, etc. So I will say that this is not a science show per se, right? This is just us chopping it up and really setting the stage for a healthier life, 30 minutes at a time. So please tune in. I would love to have you on, Brian, and to have other people who are interested on. If you can follow us at HOH the podcast on Instagram, that would be great. And you can tune in and subscribe wherever you listen to playlists on iTunes, Spotify, and Stitcher Podcasts.
Definitely. And when does that launch?
That launches August 10th. So the trailer is up now. Currently, we are recording episodes, but August 10th, we will have our first episode, and we're super excited. I'm not gonna tell y'all, right? We're gonna keep it mysterious what the first episode is gonna be, but we have a ton of amazing topics that span from fragile masculinity to homophobia in healthcare to trusting Black women, and a bunch more. We're even gonna be talking about parents and their feelings about sending their kids back to school during COVID. So we're going to be hitting a range of nuanced topics. I think they're topics that many people will be able to connect with. It's large umbrella topics. So we're so excited, and we can't wait to have everyone join.
Oh, that's great. Yeah, I can't wait to check it out myself. So everyone, make sure you definitely go check out the podcast when it launches and support Dr. Charles. And then Dr. Charles, we probably gonna have to get you, in on our educational platform too, to maybe teach some stuff about writing and all that stuff as well, man.
Whatever you need, I'm here.
Definitely. Is there anything else that you wanted to tell the folks?
Yeah, the last thing that I just want to leave people with is your health is within your grasp, right? Like, there are a lot of small things that you can do in terms of just tweaking your diet, increasing your exercise, and alleviating yourself of stress. By alleviating yourself of stress, I think it's two things: sleeping a little bit more and sleeping regularly, and really putting down the laptop, especially for work and other things. I think that the cumulative stress is really knocking out Black people, especially. I think that these are preventable, hypertension, type 2 diabetes. These are all preventative diseases, but it really takes one small change. So I would encourage you all to just take a small change in terms of alleviating stress, increasing your sleep, changing your diet, and exercising.
Yeah, that's great advice, man. And again, Dr. Charles, appreciate you for coming on the podcast, and we're definitely looking forward to joining you and as fans and listeners of your new podcast.
Thank you, my brother. Again, everyone, please follow at HOH the podcast, and my personal Instagram is at Ask Dr. Charles. If you have any questions, feel free to DM me or email me. But again, thank you so much, Brian, for having me on the podcast. This is amazing, and it's great to connect with all your viewers.
Thank you.